right, and thank you for joining us again for our final session of the day. Last but certainly not least, we're joined. Well, I've got with me here Sam Paradice. Myself and Sam Paradice and myself are going to discuss somewhat of a deep dive into CLINUVEL, and we're lucky to have with us Dr. Philippe Wolgen and Malcolm Bull. Can you hear us there, Philippe and Malcolm?
Loud and clear. Can you hear us?
Yep, perfect.
I can hear you too, guys.
Great. Well, thanks for joining us. Really appreciate your time. I know you've got a lot on your plate. Just for everyone on the line, we've got do still have the question box live. So if anyone has any questions, please feel free to send them through, and we'll aim to get them asked if time permits. So given the forum of this is quite casual, and we're hoping to spend the full hour with you both, we were wondering if we could, I guess, perhaps go back to the start of CLINUVEL, and maybe Philippe, you could give us a bit of history on the business, and right back to 2005, hopefully, when you at first caught your attention.
But first of all, it's a pleasure seeing you both in good health, Sam and Shaun. We are finding ourselves on opposite ends of the world, and I have to confess it was only earlier this week that I learned about your program for the day, and I've been mulling over what I could possibly discuss with you over 60 minutes that would frustrate your happy hour on Friday afternoon, but I'll give it my all. If we go back in history briefly, and a question about attraction, I'd studied this company for a good year, starting in 2004. The company was morphed in its third iteration as Epitan, and the word attraction, there was not a lot that attracted or that was attractive. The corporate strategy was defective, the structure was defunct, its mission was nugatory. Australian capital markets were unresponsive, somewhat indifferent. The legacy, and you need to keep in mind that the company started in 1980 and had more or less wasted its IP time over 25 years to 2005, and the legacy was gargantuan. It was a difficult endeavor, let's put it this way. The environment was challenging. There was resistance at board and management level to any meaningful change. And so I dare to say it was perhaps not infatuation at first sight. It was more an arranged marriage where you need to take your own dowry of $68 million to make something out of it.
Yeah.
But against all that gloom, there were two aspects that were somehow enticing, and I divided into people and data technology. And so if we start with people, there were 5 individuals that piqued my interest or curiosity, 2 at board level. So to fast forward, there were 2. There was Stan McLeish, the ex-CSL general manager, the right-hand man of Brian McNamee that founded CSL to what it is today. And then there was Henk Eggersborg, a CSO with a long track record of approving 50 drugs on the US market as president of Wise. So these 2 were of interest. And then there were 3 staff members. There was a scientific technical man from CSL who had gone to all the stations of development. His name is Dennis Wright, and he's today the CSO. It was clear that it was a man of knowledge and experience. But the only problem with him was at the time that every time you wanted to pose him a question and get more information, there was a team around him that would answer for him. So we needed to get rid of that problem in order to see him grow and evolve. And then there was a young, ambitious accountant that has grown to be, I believe, one of the best CFOs in our industry, Darren Keamy. He had a background, a solid background. He had a refreshing sincerity about him. And that's important because once you switch off the lights at night, you want to have someone sitting next to the cash till that you fully trust. And in these companies, that is of utmost importance. And then we had a young secretary who's become my PA for the last 16 years. So there was something there. And then on the technology and data, and you briefed me that your audience today are generalists and not specifically knowledgeable on pharma. Usually in our industry is that you find technology. The technology has been developed for a purpose, and then it goes through all the phases, the lab, and then the clinical 1, 2, and 3. And then there is a concept that it will address, prevent, or cure some diseases. And then post-commercial stage, you will actually then start to discover how the safety profile of that particular drug, and certainly if we differentiate the novel drugs, the breakthrough drugs, something that hasn't been tested before, then you will find out post-marketing how these drugs will stand up to the scrutiny. And then you often see that the side effect list grows, it interferes with other medication, you need to readjust your label, and in the worst case scenario, these drugs are pulled off the market. Now, in EpiTan, the company was called in 2005 EpiTan. There was a different phenomenon, and that was a rare anomaly, which was, it was technology that had a life of 25 years. There was no real purpose for it, but there were 2 decades of data, and that's a reverse. And that rare anomaly of finding a technology that has somehow a constant, a predictable safety profile without actually knowing where to use it, that triggered my curiosity, because that's very rare to find. So, yeah, if I bring it back to, to your attraction, is the there are many cultures where actually, if you devote your time and energy and have an unconditional commitment, an arranged marriage can actually work. And I think that's the best way to summarize CLINUVEL. And then if you then fast forward and you bring your audience to where we started and where we are today, I hold my team and I try to warn them not to watch the iPhone every day and Yahoo Finance. The share price is just a mere indication of what you do, but it by no means reflects the health of a company. And so if you wanted to take an indicator or parameter, if you look at today, exactly 16 years ago, the average traded value of the company was just under $100,000. Today's traded value, 16 years later in October, is over $6 million. So what I tell my staff is, we've done okay, and not more than that. And so that's, I think, the history a bit of CLINUVEL.
That's actually quite interesting insight, Philippe. I'd never thought of it from that angle, that there was an anomaly about the safety data versus the use case. It's quite interesting. Is that a rare situation to find in the world?
Yeah, extremely rare. If you scan all the biotechs and pharmaceutical companies, they start from the opposite end. You're trying to solve a problem and then hypothesize with chemistry and reformulate or formulate the chemistry into a final product, and then hope that the biological response stands up. And then slowly you will discover over phase 1, 2, and 3 trials, but certainly post-marketing, when you actually get to the commercial green light, then you will discover how the safety stands up. And that's a big unknown and a huge risk. And then you add the risk of not being able to fill prescriptions. You may propose a treatment, but the prescriber is not so keen and willing to administer to patients, or the patients don't show that demand that you had projected in your forecast. And then all that time that you spent on 10, 12 years, that's the median, in developing it, these sunk costs are gone, and the chances of return are little. In our sector, and if you differentiate in our field of melanocortins, there are examples where these melanocortins came to market, where the commercial success is far-fetched. It hasn't worked out the way these companies wanted. And so, yeah, it is quite rare to find technology that starts from the other end. It's seemingly is safe, and then we need to make a horizon, but it has been proven safe so far for 20 odd years. But where to use it? And so I was quite intrigued by that question, yes.
So Philippe, just to be clear, the drug that Epitan was using had been used for tanning purposes prior to this, right? And it was that long period of time that showed that it was safe. Is that what is that where the history of safety came from?
Well, the byproduct of the molecule, of the chemistry, became for the first, second, and third management the ultimate goal to commercialize it. So it's quite an interesting story. It's being written in 2 places in the world at the moment. And you need to put it in context of the emergence of Botox. At the time, everyone was looking for the second Botox because Botox was a drug that was used for blepharospasm, so triggers of the eye, muscle triggers of the eye. They found out that it actually freezes your face, and you could convert it into a lifestyle recreational drug, and that's generated billions, as we know. So the quest was to find that second product. The first, second, and third management, starting in 1980, they fell in love with the prospect, the idea, the illusion that you could enter a recreational cosmetic market, and it was perpetuated up to 2005. So there's 25 years of funding, of continuous capital raising, with the belief, and that's the believing in and we always give disproportionate weight to improbabilities. They actually believed that you could commercialize a hormone injectable in men as a recreational drug. But of course, the policemen in our fields, the FDA and EMA, said, well, unless you show us a genuine medical use, this is not going to be acceptable. And that's how the company came to a halt in mid-2005.
So then how come Botox has been so successful and allowed?
Yeah, well, Botox was approved for these muscular disorders, for these spasms. And as the medical community started to learn and was promoted by Allergan at the time on its byproduct, which is the rejuvenation or the perception of rejuvenation by tightening your skin, it was promoted off-label. But that off-label was heavily penalized by the FDA. But Allergan saw it as a cost of their business. They just paid these fines year after year while promoting the drug for other purposes. Yeah, that practice has come to a standstill. And I'm quite averse to that kind of use of medical products, not alone because you don't know the side effects. And you bear a huge responsibility and liability as a company. So that was unthinkable for a small company like EpiTan at the days. But I also fundamentally believe you shouldn't use hormones for recreational purposes. That's not our social mandate.
Yeah. And Malcolm, I mean, Philippe, just finally on the history, you made another quite important decision, which was reformulating the existing compound in from an oral into an injectable formulation. Would you mind giving us a bit of insight into your thinking there with the reformulation?
Yeah, so you mentioned oral. It has never been an oral. It was always an injectable. The product originally was an injectable that needed to be administered every single day. So patients had to come to the hospital every single day. And that's not a commercial product. That's an illusion. Yeah. And so we sat down together with our technical teams and what is the ideal profile. Now you are then going to weigh up the commercial use, the future commercial use that you envisage versus the biological response that you want to elicit. In other words, injecting an aspirin and the acetylsalicylic acid in an injectable behaves differently than a pill. And so we wanted to contain the release profile. And so our design was, we are going to inject the drug, minimal exposure to the drug, but maximum dynamic effects, meaning maximum effects that we want to target. And so we inject the drug every 2 months. So you need 6 injections per year, and then it gives you that overall photoprotection. Yeah, and that was a novelty that hadn't been done before. That took quite some efforts and resources.
Very good. Well, just moving now, I suppose, into our next kind of topic, which I wanted to start unpacking, was just capital allocation. It's something we pay a lot of attention to, and it's clear from reading, your CEO letter and watching the business develop that you're building a very strong balance sheet at CLINUVEL, and this compares in quite a lot of contrast to the rest of the industry, which seems quite content to continually raise capital from share issuances. I'm just curious about, maybe some of the lessons that you've learnt through your career that have formed such a strong view on this. And it's obviously a high conviction kind of view you've got. I was wondering if you could unpack a bit of the source of that.
I don't have the answer for all the technology of pharma biotech. I can only tell you what worked for us. There's a fallacy to believe that you got a universal measure that is going to be applicable to all these companies. You need to look at them one by one. And so what worked for us, given the position we were in, given the legacy, given the funding available and so forth, it was clear that we needed to restructure the company. We needed to, I think, upend the approach to our cost management, our approach to capital markets, and I saw it as my task to a team that was built from ground up and that was also had to deal with the history of the company. I saw it as my team, as my task to raise awareness of the journey ahead. And that would have an impact on capital allocation and value. And so the single most expensive word in our industry is called outsourcing.
Yeah.
And the two most expensive words are called small scale. And then the three most expensive words in pharmaceutical and biotech. And so for your audience, you are going through the entire program from the lab to phase 1, phase 2, phase 3. The median time, if you succeed, is 10 to 12 years. All these expenditures, all these costs are incurred, all these resources are deployed, your talent is groomed, you hope that they stay in the company and that it doesn't walk out the door. And then we, all of us, need to go to the preeminent gate. And on the left-hand side, you have the European Medicines Agency that gives you access to the European pharmaceutical market. And on the right-hand side, you've got the FDA, the Food and Drug Administration, that gives you access to the largest pharmaceutical market in the world. And they unlock value. And on that one day, after 12 years, on one single day, they can and may enunciate, if they are not sure about it, and not only on rational grounds, if the risk-benefit doesn't stand up, but if you've done everything right, and they're still not sure about novel technology, they can enunciate the three expensive words: one more trial. And one more trial equates to 3 to 5 years delays. It equates to the cost of running a new trial. It includes the running of the company for 3 to 5 years, plus the hope, the faint hope, that you actually are going to retain the talent that is disillusioned and disappointed with the outcome in the company. Well, there's one thing certain: it's going to lead on the day and after to massive loss of enterprise value. So we needed to avoid that at all costs within the legal boundaries. That could not befall the company after the history. There had to be a different strategy, and that would need to impact the way we manage the cost and the eventual value, of course. This is the third time that we've spoken, and I think your questions are always somehow different than other market participants. And certainly Sam has the inkling to always ask me, what are your resources, influences, and so he becomes predictable. So I kind of anticipated that it would come. And so the bugbears, the task of a managing director is to conduct the orchestra without actually playing an instrument or knowing the notes. But my task was to pass on the bugbears. And so who influenced you on that? And is that fair that you pass on all your fears to your staff? Well, I don't know if it's fair, but it worked. And so my father was the first one that influenced me on this. And I'm going to share you an anecdote that we're thinking of. He had a really nasty habit. He still has it, but it eased down a bit in his professional life to teach me the lessons of life, of professional life, in two manners: either playful or infused with fear. And on a good day, he would combine both. And so on the day that I graduated, my first graduation, he took me in the aisles and he said, what are you going to do with yourself in society? Are you going to contribute? And it wasn't really what I wanted to hear on that day. And he said to me, you remember how high jump the discipline in track and field, how high jump has evolved over time. So sure, I remember, and I knew where it was going. And so in ancient days, high jump, the technique was the straddle. We all know that in finance. And then it morphed in 1928 at the Amsterdam Olympics to the flying scissors. And if you've ever seen it, it's really an odd technique where you've got a short runway, and then you flick your legs, and then you have to pass and master the bar. And that was the norm. It was the Canadian athlete Calderwood who introduced it. And that technique held for 40 years. So I needed to tell him that on that day of graduation, yeah, it was Calderwood, said great. And then who is the second technique? Well, the second was introduced by David Fosbury, as we all know, in 1968 in the Mexican Olympics. And David Fosbury was the first one to flick his body with an arched back over the bar. His legs would follow, and that became known as the Fosbury flop. And so my dad already knew that if I had to choose a path in life, it would definitely be something that would be not associated with flops. So in CLINUVEL, I had two choices. This flying scissors Fosbury flop needed to be the scissors because we needed to start cutting costs to bring the company to its illusory end. And so in order to address the first doctrine in pharmaceuticals, outsourcing, we brought all the talent in-house. And with the finance team, we calculated that would be a market reduction in cost. If you fast forward, that's financial discipline over 16 years. And let's dissect from starting in January 2006 to October 2014, when we got the first market approval for this product and completed the turnaround. We spent $150 million in research and development costs. And that $150 million constitutes 16 to 20% of the median costs of developing a new drug to market, as is published, well published in literature and by the Tufts Center for Drug Development, which has a range between $600 million and $1.2 billion to bring a new drug to market. So we did that at 16 to 20%. The second approach, and that probably answers your question to capital allocation, was usual in our industry is indeed the fact that you need to address the heroin addiction. You need a constant fix of coming to the market, and then you need another capital raising, and your cost projections haven't been correct, and then you need another one, and so forth. But the market is smart because it knows that these biotech and pharmaceutical companies are going to come. It's just a matter of time. And if you're really well versed in the field, you can look at the monthly expenditures versus cash reserves, and then you start discounting these companies. But then when you sit down with the underwriter on the day and you look at the subscribers, you are going to further discount the value. So you have compounded discount. It's discount on discount. And so we said we don't want that. And there is no reason and you have to go back into 15 years, why the capital adequacy or the liquidity ratios wouldn't apply to companies like Pharmas or CLINUVEL at the time. And so we instituted a rule, and that is we need to have sufficient cash reserves for 1 year of expenditures. And the happy byproduct was, of course, that then the auditors would sign off in each annual report and don't categorize you as a company with at peril of being a continuous and growing concern. Now, post-marketing, so since 2014, when we became commercial, we increased that bar and we said, okay, we are going to have a liquidity ratio of 2.5 to 3 years of the funding, reserve funding. That gives us confidence and it gives the market confidence. Now, the unintentional byproduct of that strategy was that we incurred a minimum dilution. It was unintentional, it wasn't planned, but it meant that we had less than 300% dilution from October 2005 to date. So exactly 16 years on the date. Yeah, then the question is often posed to us, well, why did you manage the funds in this way in your capital raisings? Why couldn't you have raised more capital when it was available and when you gained more confidence that you were progressing and that you actually could make it to the finishing line? And our discussions at the time, and so I rewrite my notes, the discussions at the time were that given the history, the probability of showing returns on investment on $150 million is far higher than showing returns on 600 million or 1.2 billion. And that's embedded in the belief in the value system. Now, there's something else that happens, and we can't take credit for it. It was just a mere hypothesis. In the end of 2006, early 2007, we had board meetings and we talked about the changing landscape. And so I usually look from macro to micro. And so there were discussions in the US on both sides of the aisles on drug pricing, on the pharmaceutical companies. They were not making great headlines. And in Europe, we had the same problem where the governments and left wing was dominating the parliaments. And so we hypothesized as well, what is the future going to look like in 10 years' time if and when we come to market? And projecting beyond 3-4 years is ludicrous. There are so many changes, but there was call it a probability assessment. And we noted and minuted these discussions, and in the meantime we were doing market research. And supposedly, if the company succeeds in its mission and the drug comes to market for these populations, market research in the US, in Australia, in Europe, what would be an acceptable price? How would you market it? What would be the economic conditions? And these reports were quite interesting, but they had a long list of assumptions. Now I'm going to draw you into the real world around CLINUVEL and most of these pharmaceutical companies. So keep in mind the hypothesis we had in early 2007 and the thoughts that we were exchanging. When a product, a novel product comes to market in a unified union, which is fiscally and certainly pharmaceutically far from unified. So you come to the European Union and you see yourself negotiating with 17 countries. So if you believe that the values unlocked by EMA and FDA will come again, because the real work starts when you negotiate with the state insurers, the private insurers, the intermediaries, and there is nothing that can prepare you for that. So you form your team with consultants, lawyers, health economists, you prepare, and it's a fortune that you spend on it, but you better be prepared, because everything will be thrown at you to lower the price or not to get the drug on the market. Now, we went through that process in 2016 in Germany, and these discussions are confidential, but I can give you the global contour of how it unfolds. We went through a year and a half of negotiation. It was clear that we were in a stalemate. They would not accept our price. We had a justification for the price of the product. We had a rationale. We had a budget impact. We had everything that was needed. On top of that, we told the German insurers, the state insurers and the private insurers, we are treating all the European countries equitably. There's going to be one price. And there's a good reason why you want that, because there's cross-border talk, there's information going from nation to nation, the insurers are allied. We introduced, as one of the very few, a uniform price. Same conditions for each country, for each insurer, no rebates, no discounts, no paybacks. And they didn't accept that. And we escalated that to a court of arbitration in Berlin. And after long preparation, on that one day, starting at 8:30 in the morning to 7:30 in the evening, medical triage is going to be performed. That's medical triage at its worst form, because at that day, it will be decided who gets the treatment and who doesn't. That's the contour of healthcare. So we were there in Berlin, and sure enough, all the arguments were thrown at us why the price would not be accepted, why the condition would not be accepted, why the drug would be not safe, why it was not effective. And somehow midway the day, the economic camp of the opposite party was bargaining in front of the three judges, but surely CLINUVEL would not have been prudent in its financial management. It had overspent, it had overcapitalized its program, it had overrepresented, but it hadn't done their homework. And so we opened up briefcase and we presented a report of a third auditor that had gone through our books again. So we audited, as you know, twice a year. And we commissioned the third auditor. And we said, no, we have spent $150 million on this program and not a penny more. And that was 16 to 20% less than they had ever envisaged. And I believe that carried us forward. So I think the morale of the story, certainly for us, and I can't vie for any other company, is that financial discipline and the strategy that they execute can actually lead to value. Now, if the German outcome would have been negative, either this company would have not been here today or the value would have been considerably less. And so, yeah, we can't take credit for anticipating it. We had a hypothesis, but it really played out 10 years later. And I think the final comment is, when you ask about capital allocation and why this way and why not in any other way, there is in computer technology a theorem, a principle that has been used in biology, and I think it really applies to us. It's an English philosopher called Ashbury, and he launched, and you may know that, the law of requisite variety. And the law of requisite variety is really summarized in one sentence, is the organism needs to adapt its complexity according to the complexity of the environment. And I really think that is applicable to companies like ours who are innovating or launching breakthrough drugs. The complexity of the environment was enormous. We needed to have a different approach. And so that's the short on capital allocation.
Fantastic.
That's a really good insight.
Amazing.
Yeah. Very interesting. I suppose that kind of segues well into the next part, which we really wanted to talk about, I mean, we love talking to companies about the culture of the business, and we've found that the real core culture comes from the past experiences and successes and failures that have happened through the journey. And we thought it'd be really great to just hear some stories from you, I suppose, that have helped shape what is today the CLINUVEL culture. If you could share some with us, some more, perhaps.
Yeah, it's a big word, culture, you know. Well, the word culture is arguably the most frequently posed question by job applicants, interviewees, who seek the eponymous answer to find reassurance before they join an organization. What is the culture? And investors, in my view, they seek the social fabric of a company to make an inference on the value creation later on, and seek whether there's a correlate. And so I'm happy to share you some of our thinking. Of course, CLINUVEL has a set of beliefs, values, shared assumptions, a group or corporate norm, and that's the thin layer, the foundation where it starts. And we also added call it my negative anchors to the mix, with a number of influences. That's for Sam, and so the first one is concerning information and data within the company. Our belief was and is, you are innovating, and for that matter, you are going to make errors along the way. And information needs to flow between people from division to division. And for that to occur, you need to create a safe environment where everyone that joins the ranks is able to explore, explain, and express. And there cannot be concealment of information or embellishment or manipulation, or you need to be able to have an environment where people are going to discuss the good and the bad experiments, the good and the bad progress based on data, without having the fear of being penalized or sanctioned for it. It sounds very great, and theoretically the skeptics will say, oh, great, but how does it work? And the answer is, sure, if someone makes 2 or 3 times the same error, there will be a discussion and an evaluation. But in general, there has to be an environment where you are free to discuss the good and the bad. The second negative anchor is really surrounding conduct. Under a roof of 21 nations, 12 languages, different ethnicities, reasonable equal gender, so we try to keep tab on that. Also at management and board levels, we want equal gender everywhere, so you're a balanced company. Transgenders, in that mix, there is no room for misconduct in any shape or form. No bullying, no pressure, no untoward remarks. It needs to be an environment where you're free to express yourself within the rules of the game, but it gives people an existence. In my view, in the third of the time of the week, and so we assume for argument's sake that it's 40 hours, it's far more, but let's say it's 40 hours according to the employment laws. labor is far more than the exchange of effort for wage. I see it as a total commitment, intensity to a project that needs to come to fruition. And so the rules of conduct apply. And sometimes there's small issues and sometimes there are larger issues, but everyone needs to understand what to expect from us and what we expect from them. And then the third one, and so I've grown up in the era of Parmalat and Enron and Lehman Brothers. There cannot be misrepresentations of balance sheet activities. Finance has to be impeccable and reported as it is. And for that, you need a sound finance team. And so with Kimi and his team, there's no concern in my view. And if you look at our discipline and financial performance the last 16 years, it's quite constant. With all these rules of conduct, you've laid the foundation of how you're going to operate with each other. And I think where we differ from the peers is in the way we communicate internally and the responsibilities we assign. And so that's slightly different because we hire certainly within our sector, but we also hire people of different ilk, different background, historians, mathematicians, engineers, people who don't necessarily would fit in pharmaceuticals, but just good at problem solving. And there is a belief among us that there is no reason why you couldn't deploy the skills of solving problems in one domain or abstract field, and why you couldn't apply that in our company. And that, I think, is part of the ingredients that led us to where we are today. And I see no reasons why it shouldn't continue in this way. So that's the first element of culture. But the notion of culture is really something of the last 20 years, and that's the main theme in organizational behavior. I think one of my biggest influences is a psychologist called Daniel Kahneman, who got the Nobel Prize for economics in 2002. He's probably the first and the last psychologist to get it. And he understood the power of our subconscious mind and biases that we introduce every day to work. And if you take that further, the question that keeps coming up, of course, is you've done one stage of the journey reasonably well. How is this going to continue? Is if and when and as we are expanding, how do you keep the same engagement, commitment, and culture in the company? And that's darn difficult because as you grow, you've got more protocols, you've got more systems, you've got more processes, and then you join the ranks as being part of the processes without the immediate tangible outcome that the smaller team had. And so what are you losing along that way? And how do you get people to be aligned, but to perform above and beyond the bare minimum? And so we've got about 4 pillars of a system that so far has worked, but that needs to more or less safeguard how we're going to grow and how we're going to continue the success. The first one is you need to encourage to think and to contribute. It sounds really trite, but it's really true, because if you have influx of new people from different backgrounds, different professions, different professional experience, there is no room for intimidation or silence or reservation. From day one, you need to contribute and share your thoughts. We need to be genuinely interested in the thought process of the other one, because we are constantly battling to solve problems. And someone in management meetings, staff meetings, that presents to a board, but is somehow reserved or is not keen to contribute, that's not going to work with us. And so there is a beautiful saying. It's a English philosopher, Bertrand Russell, and he said, died at the age of 98. He said, "Try not to discourage thinking, for sure you will succeed." So there is no reason why a young person of 25 years old with an analytical mind couldn't apply that in our company. And so that's the one, I think, pillar of continuing what we do. The other one is that we hear that from the newly joined applicants or the staff. We hear it from the recruiters that do the 360 feedback, that we expose people to far more disciplines than what they trained for or that background alludes to. So we want someone in technology to also understand commercial negotiations, and someone in scientific affairs needs to understand the journey to commercial. And our finance people need to be in part be involved in diligence and in business units. And so you need to expose staff to a much wider set of disciplines to make it interesting, to retain them, to train them, and then you set yourself apart from peers. The way you do it is by setting what I call Olympic goals, 3 or 4 years out and not more. So after 1 year in the company, there are 2 evaluations, and it will then lead to the discussion, well, is this going to be a permanent recruit and staff member, yes or no? And then you start setting 3 to 4 year goals, career development plans for the members. So they know where we're going, we know where we're going. And then we align everyone in terms of KPIs, key performance indicators. We also align everyone with our performance rights plan. So there's a real rationale that we set our performance rights plans every 4 years for everyone in the company, starting with me to down. And the reason is because we want to be aligned in our objectives. I don't want a second guessing where people say, well, we don't quite know where we're going or why we're doing it, and how does it affect me, and how does it affect my pay at the end of the year. We're all doing the same thing. So these Olympic goals work. And if you achieve 75% of these goals, you're doing pretty well. And then the last part, and we get frequent feedback on that from recruiters and all the agencies we hire. And it's somewhat alien and time consuming. We mine for the nuggets. And that means that you need to recruit as part of your business all year round. Even if you have no vacancies, just look for that one individual with the intriguing mind, with the predisposition where it fits, someone that is of interest. And if it's of high interest, you will need to create a position for that person. But it's far better than just running to the market only when you have a vacancy, because what is the statistical chance that you're going to find that match? So all our line managers, they need to recruit on a perpetual basis. Interview, get better at it, see people week in, week out. And so these are the 4 pillars. Culture is such a charged and loaded terminology. I've got a good colleague of mine, a friend in London. He's a management consultant, and he's made a business out of dissecting all these companies, and he sees it, and I think he's good at it. He's a problem fixer. And he says to me, when I enter a company, I can smell it. It's really bizarre. I don't know. I think I know what he means, but he does that for a living. And so the ex-governor of the Central Bank of England, Mark Carney, who presided from 2013 to 2020, he wrote a beautiful book last year, readable, concise, clear. Its values, and there's a chapter on corporate values and how we need to restore values in society, and that's not taking a moral high ground. He's one of the few that links corporate values to shareholder value. And I really believe in that. And I maybe stand corrected to be wrong, but the way he describes it really appeals to me. And so the lifetime value of retaining talent that is groomed, that is evolved in the company, can be formulaic. You can actually put a number on it. And we've got a core of 20 people out of 70 at the moment. They have been more than 8 years with the company. There are 10 who have been more than 10 years, and there are 4 that have been more than 60 years in the company. And it's, if you think of it, if you suppose that real professional life starts at the age of 30, and in most Western countries at the age of 65 it ends, 35 years of productive intellectual output, and 16 years of these 35 you spend in one company, that poses a huge burden, responsibility, because it's not only taking a products to market and providing shareholder value, it's also forming a career, a development, an individual over a course of 16 years. You need a foundation, you need a structure in the company, and you need an environment that is safe and conducive to growth. Yeah, and if you mark and explain the rules and how we are going to do it collectively, then the hope is that you retain that talent and that knowledge. And vice versa, if someone after 10 years walks out of the door, the cost of substituting that particular knowledge in our industry is immense. It takes 2-3 years to bring someone up to reasonable level of output. And that productivity and that quest for productivity is, in my view, reflected in values.
That's great. That's really good insight. A lot of things for us to follow up on there, like always.
Got a lot of reading ahead of us, I think, Philippe.
We're actually sort of running short on time here, so I suppose the last thing that might be really worthwhile going through if we had time was just the long-term opportunity. You mentioned, I suppose, in a number of the annual reports now, you aim to be the leader in optical physics and the interaction of human biology and light. What's, in your opinion, what are the large unmet needs in that broad category? Is there anything we should think about over the next 10 plus years on where you're aiming the business to be?
Okay, so in Telegram style, our belief is that is generally good and of value to the company and of value to the medical community and value to shareholders to occupy a domain that is vacant. The photomedicine is a bare discipline. There are not many companies active in it, certainly not many pharmaceutical companies. And if you then analyze what it is, It is providing, in our case, called systemic photoprotection. You inject a human being, a patient, and you give him or her photoprotection for a period of time such that the patient is not susceptible to light or UV or burn. And you therefore address the first step of photo damage and skin cancer. So at the root cause, you take away the damaging physical properties of light. Yeah, in engineering, you're doing something totally novel and away from other pharmaceuticals. You become dominant, and that is commercially and clinically interesting. And from that technology, you start concentrically, you start peeling the onion from the outside, you start expanding into associated fields. So from the porphyrias, we went to xeroderma pigmentosum, a disease, a horrific disease, where patients are intolerant to any kind of UV. They develop annual cancers, skin cancers. They have a 2 to 3 decades median survival time. And so it's something that we, as a mission, needed to address. And the larger extrapolation to the wider populations is, if you are able to address that disorder in some shape or form, in some degree, then you're taking the knowledge and the parts of the chemistry further into wider populations to prevent actinic damage, solar damage, as the first arrest to skin cancer. So it's a noble cause, and in our view also of value, in the broader sense of the word. And by being the only player in that space, you are going to dominate it. But of course, you're going to attract more because there are always going to be competition. But we believe that the field is large enough for a number of players, but we happen to be the first.
Well, why do you think it's bare? Why do you think there's no one there?
Because it was ugly. It wasn't attractive for pharmaceuticals to go there. Patients who are deprived of light and that need to live an indoors existence or nocturnal existence wasn't traditionally something that appealed to pharmaceuticals. They didn't see it as an attractive market. They didn't see it as a sizable market. But there are companies in the world that have trailblazed it, and they understood what it is to specialize in one area, to become a specialty pharma, dominate the space, and monetize it. And if you put the clinical objectives first and you actually succeeded, then the cliche holds true, the value will follow. And so we started this journey and we are going to complete it.
It's interesting. I was listening to a podcast with one of the founders of Moderna, and he was saying something very similar, that obviously the mRNA space was bare when they first started. Well, you know, now look at it.
Yeah, that's also a fascinating story.
Mm.
Yeah, there are some analogies for sure, but you need to analyze continuously, analyze a changing environment, analyze changing markets, look at what you have in terms of technology, data, knowledge, and do something with it. And if you focus, you concentrate your resources on it, there's a higher probability, in my view, and again, we can be totally wrong, than diversifying from day one and doing everything at the same time. And our industry has shown that it's not a successful formula. I don't think we are the team to take on so many projects at the same time, because you lose focus, you dilute your focus. But by becoming specialists in one area, you can actually start to dominate. And that translates, I think, back to value.
Fantastic.
Excellent.
We're at the time. I
We're,
think we're over.
we're over time here, but yeah, that's great.
That was absolutely fantastic, Philippe. I wish we could keep going. Maybe we'll have to do another session.
Well, I admit that when you invited me for this day, you were well in my ear, and I reread all the questions that you've asked on 2 previous occasions in our meetings. So I thought, what can we possibly tell you? But yeah, you're a well-respected team, and it's a pleasure having you as shareholders, really.
Oh, thank you.
And likewise, thank you. And I mean, it's amazing effort. It's another great sort of Australian success story. Overnight success, 16 years in the making.
I've never asked you, how you found us. How did you come across CLINUVEL?
Well, it's quite interesting. I was talking to our analysts, and I was discussing companies that don't raise capital in your space. And he said, CLINUVEL never raised capital. And I thought, well, this sounds good. So let's start looking. And that's it. That's how we found you.
Okay, never say never, but I understand the script here.
Yeah.
And when was that? How long ago was that?
That was probably 3 years ago.
Yeah.
It was before the approval.
Yeah.
So, when we sort of, uncovered the fact that, you'd sort of got to where you'd got with a significantly less amount of capital, and it was starting to be a few interesting signs, and we just kept digging.
You kept digging?
Yeah.
Right. Okay.
Thank you very much.
I'll leave to you.
Okay. Thank you.
All right. Thanks very much, Philippe. Thanks for your time. Thank you, Malcolm.
Thank you. Thank you, guys.